Welcome, welcome in everyone. Welcome to Tuesdays and Thursdays with Care Patrol. Today is Thursday, June the 9th. It's already June the 9th, y'all. And we appreciate you being here. It's kind of a dreary day here in Birmingham where we are. I hope the sun is shining on you, figuratively, if not literally. Today, we're going to discuss our entire series this month is on topics relating to ethics. And as each of you know, ethics is necessary, a necessary component of your recertifications. And so we're giving you these six ethical topics in 1 month to kind of hit them hard and give you the opportunity maybe to have those done and behind you. So today we're moving on and we're going to discuss ethical dilemmas that have presented us all here during COVID-19 over the past 2 years. Now, can you believe that? It's been 2 years since COVID-19 started on us. So today we're discussing ethical dilemmas during COVID-19. As you all know, your mics are muted. Please use the chat room to either ask questions or introduce yourselves or share resources or engage in discussion during this presentation. I do hope it gets y'all talking. When you talk about ethics, particularly like personal ethics, it's a very can be a very sort of touchy subject. And so I certainly don't want to be touchy with anyone, but I do hope that if you have a firm opinion about something that you will be confident in sharing that if you feel so moved. In fact, I hope anyone that's on the call will feel always confident in entering the chat room and sharing, their knowledge with us. So as we're getting through housekeeping and still admitting folks, we're doing today ethical dilemmas during COVID-19. Your mics are muted. Please use the chat room. As you know, we are credentialed by the State Board of Nursing and the State Board of Social Work, both, to do these credit hours. And some of y'all have emailed or asked in the chat before when I will be posting the certificates to the ABN. And the question is a good question, and I'm sorry I don't have an answer. I've returned my affidavit to receive the mechanism. I think they call it a tricorder. To enter the information, and I haven't received that yet. So as soon as I do, I promise I'll get everybody loaded up from when I took these over for our company, starting in February until today, now June 9th. So, but everyone will this evening who does an evaluation, everyone will get a certificate, social workers and nurses alike. And again, this is a live certificate because we do an evaluation and because we have a password to that evaluation. It allows us to dictate and say that you were present during this 55-minute training. So we will give out a password about 45 minutes into the presentation, but I'll go ahead and give you the address now for the SurveyMonkey tool that we use. And that address is, if you're ready with pen or on a note function in your phone or laptop, the address to our evaluation today is https://www.surveymonkey.com/r/all uppercase, B as in boy, the number 9, K, the number 8, S, W, K. So one more time in case you didn't get that from start to finish, if you're taking notes, and thank you, Ashley, for posting that in the chat room. I do appreciate that. The address is https://www.surveymonkey.com/r/all uppercase letters, B as in boy, the number 9, K, the number 8, SWK. So that's our SurveyMonkey link today. It is password protected. We'll give you the password/code word about 40 minutes into today's presentation. That way we know that you were here and listening, and the ABN and the Board of Social Work know that you were a participant in a live CEU, which, as you know, those take precedence, or that you need those in greater amount than you do the recorded ones. However, we do have all of these recorded dating back to February. So if you missed one and there was a topic you wanted to see, let me know. I can make it available to you, and you can get a recorded CEU. So as we continue to admit a few folks here, I will wrap up our housekeeping for the day and get us started. So, as I've mentioned many times, we're discussing ethical dilemmas during COVID-19. Our objectives are threefold, and these will be on the evaluation. We want to see, we're going to discover the 5 ethical basics of dilemmas during a pandemic, and the 7 ethical dilemmas during a pandemic, or excuse me, the 5 ethical basics during a pandemic and the 7 ethical dilemmas of that decision making during a pandemic. Kind of a mouthful. Our second objective is to discuss the 5 procedural values. So these are not ethical concerns, they are the application of those concerns, if you will, and how to enact those. And then we will see how this assists us in making difficult choices. And then I'm going to give you 3 difficult choices. And this is where I'd hope, and mentioned earlier, that I hope you will feel comfortable in discussing things, and just without, I know I don't need to say this, but let's not have this be a political forum. This is a nursing and a social work forum. And so, I feel like anything that we use in the comment section ought to relate back to our practice or our experience or data, or, whatever guiding principle we have, but not a political discussion. That's a different forum. It's not this one. But when we do discuss these ethical dilemmas, which are political in nature, I hope y'all will feel like you can be heard here. And so we're going to pose 3 ethical dilemmas for y'all to consider, both while we're here talking together today, and also on the evaluation. There's multiple choice. Don't worry. But I do want to introduce these because I think they're novel and interesting, and I think that we'll get something out of it. So let's get started. I love this cartoon, and I just want to take a side here to say that all of you, in every patient setting, certainly those of you that work, directly with patients in clinics or in the hospital setting, all of you, I have felt from the very beginning of this pandemic, are superheroes. Angels is really how I view you. But I like this cartoon. This fella who's putting on his mask says, when I was a kid, I wanted to be a superhero. And his colleague who's putting on her gloves says, and you became one. And that's true. You're all superheroes to me, and not just me, but many people across the country and across the world look to you as healthcare givers in awe. Back in 2020, and I must say, as I was researching this topic, which was proposed by one of our attendees recently, as I was researching this and researching the topic around ethics, specifically related to COVID, the majority of the information and the quotes and the articles came really from March, April, and May of 2020, which y'all remember that time. It was the height of the second wave in the United States. And so at that time, the UN Deputy Secretary General Mohammed said of the pandemic, "We are facing a human crisis unlike any we have experienced," and went on to say, "Our social fabric and cohesion is under stress." Well, that's the lead in to this discussion. Ethics are the bind of society. And if those are under stress, we need to examine those and see perhaps if we can find some solution for ourselves or for those who depend on us. So there are 5 what I discovered, and again, these are our ideas put forth in 2020. And so it's interesting now to sort of look back on them, but I'm going to present them as if they're current. And so this was written by there's a wonderful website that I happened upon. I'll share it with you. I think I can type it. If I can do 2 things at once, which I may not be able to do, can type it into the chat room, but it's MARKKALA. Markela, I believe, but it's an ethical institute, or an institute that addresses ethical issues. And truly, y'all, if this is a topic that has interest for you, you can Google most anything in that Markela Institute and find really meaty, interesting information. One of them that I found was this article written by a Catholic priest who's a member of the think tank. And so he had said, the thing we've got to remember in the pandemic is it's not about you. Well, that all came to pass, didn't it? We all sort of got that truly did come to pass. And so, but what we learned and what was predicted and came to be true was that we are interconnected, so intimately now interconnected that we are not able to pull ourselves apart. And just think about it, just in healthcare, think about the various different specialties in healthcare and how those are in many ways siloed. And so that your orthopedist wouldn't have little to no knowledge of your cardio plan of care. And that's just healthcare. Everything else, everything in our lives, our appliances, our phones, our automobiles, our homes, the things in our homes, everything depends on other people. And when there's a breakdown in that, we've seen what's happened. Grocery store shelves empty. We are so inextricably linked that we have to get this right. We have to take the appropriate ethical stance and view moving forward in order to continue. And so we have to, in this article and in my mind, take the long view, which is also something that those of us in the South know as faith. So we trust in something that we cannot see, any evidence of, but we know is there. And we know that by acting as if it is there, even though we can't see it, we are better prepared. Does that make sense? And so we have to trust that if we're told by the authorities who know what they're talking about from the data and the science that we need to do X, Y, and Z, this ethical principle says, yes, we need to do X, Y, and Z because we're interconnected and related. And we may never know the benefits of doing this, but if we don't do this, we may very well know very harsh benefits. So take the long view during COVID-19. And then he says, and I agree, don't fear everything, but fear the right things. And we'll talk a little bit more about fearing things and misinformation a little bit later as we talk today. But this fellow wraps up in many ways what we'll discuss, which is that the pandemic changed our relationship to others in a healthcare setting, for instance, whereas in the past, each patient would be addressed, a plan of care would be established, they would be followed through to the end of that plan of care, if such thing existed. Now, it's really constant triage, or it was more so, with the time of this article in May of 2020, in which it was taking the patient that had the greatest need at that moment, and then the patient that had a lesser need may actually suffer. And so, but that was necessary, even though suffering was caused in the eyes of this writer because we had to save the people who were most likely savable, save the most lives. And then we also had to put those people in a triage situation and say, if we are saving someone who's savable or saving someone who's savable and is a healthcare worker, the healthcare worker takes precedence. That's the ethic promoted by this author, and you know it to be true. It's the ethic that we followed as a society as the pandemic raged. So, and this person, true to being a person of the priesthood, counsels us to beware the bias and blaming. And I don't think this simply applies to those who are of Asian or Chinese descent, although it does most directly apply to folks there who faced a terrible bias and backlash because of a disease that was just as much out of their control as of ours and anyone else's. So there is the bias and blaming, but there's something more nuanced that may take place, which is the blaming or the naming of those who have COVID or who spread COVID through contact with others while having it. And so we want to be very clear that we don't develop that bias in this country. And a similar bias would be, and we'll discuss this, the bias of those who are vaccinated versus those who are not. And so in each case, if we can beware of bias, no matter which side of that fence we sit, if we can beware of bias, we can come together to find a solution that will be fitting for both of us, we hope. And that generally means I lose a little and they lose a little. But that's how life is, isn't it? So in general, the ethics of care, healthcare, and the ethics of COVID come down to this: the measures that cause minimal damage to an individual and greater good for the society should be the ethical principle of decision making. And we'll discuss this a little bit as we move on. So here are what I found to be also an interesting, let's go back. Interesting article by in that same institute. And it's the 7 ethical principles that ought to guide us in decision making in a pandemic crisis. Now, I strike that. This was an article by an Indian physician working and practicing in India. And he was saying that our first ethical principle ought to be minimizing harm. And it's the same thing I just said: minimal damage to an individual and greater good for the society. Are any of you Star Trek fans? Probably not. That's kind of nerdy. I'm kind of nerdy. But in the second Star Trek movie, when Spock dies, and I'm sorry if I let out the cat out of the bag for anybody, I apologize. He comes back. I also let out the cat on that one. But when Spock dies, he puts his hand up to Captain Kirk and says that the needs of the few or the one are outweighed by the needs of the many. And that is that's minimizing harm. And in the case of the movie, it was a selfless sacrifice that he gave up himself for the ship. But it is a principle that stuck with me as a whatever teenage-year-old kid I was, that I sort of tried to live by, which is putting the greater good before my own, if I can, knowing that is in my best interest to do so. But what we then want to say is, when we're minimizing harm, then the second ethical principle ought to be proportionality, which basically, are we making decisions that are proportional to the threat and also sufficiently adequate for protecting the public? And I think there are numerous debates still about the proportionality of the steps we took in things like isolating nursing home patients for their families, And this is part of the fluid nature of ethics and of decision making and of COVID and in a pandemic, is that this proportionality. This is new, that we've had to think. Okay, how do we do this? How do we protect these folks? And is it protecting them to keep them from their families? We thought it was. We found out it wasn't. So now nursing homes and assisted livings, for the most part, if not wholly, all have a policy of allowing visitation now, even when there's COVID in the building, by family at any time. Not quite what it once was in terms of visitation, but certainly an improvement over what we saw as what I think was a disproportionate response. And solidarity. So this is where we all know this to be true. People cross-trained during the pandemic, did they not? Waiters became food delivery folks. My wife, who works in officiating for the Southeastern Conference and developed a website that allows them to do multiple conferences, payments and contracts and training, et cetera. She, who had no knowledge of it, chose and did create a portal to report testing data on a daily basis regarding officials and the ability to have or to not have games. And they did not have to cancel a single game. And she did this for 7 conferences for multiple sports. And my point is, it was solidarity. She did something that was outside her wheelhouse because it was needed and because she had the tool and resource to do it with a little tweaking, but it was a show of solidarity. And this is what you all did. How many of you, I know this to be true, how many of you have done things during COVID that were not prior to that part of your core work? Okay, you filled in. That's what we all filled in. Now, fairness, one of the ethical principles in decision making. Fairness is an easy thing to talk about in a way. We want to be fair. We want for things resource allocation to be based on sound reasoning. But when we look a little deeper into fairness, what we find is that COVID-19 disproportionately affected those who are in the lower class of society economically. So people who are poor, people who are the working poor, people who are on benefits, these people were disproportionately affected by COVID-19 because they did not have access to healthcare. And access to healthcare in the US is a huge problem, as you know. And so our response in this respect was not and has not been fair. And we've opened as you all know, a huge hole in the healthcare system, and we don't really know how we're going to repair it. But one of the things we know we have to do is enable access. So number 5, according to this Indian physician practicing in India, number 5 of his 7 ethical principles that should guide decision-making during the pandemic, and again, dating back to 2020, but they held true, and maybe in a different way than he anticipated, but they held true. Was the duty to provide. This is y'all. And this is his sense, is that all healthcare workers are ethically bound with an obligation to provide their services during a pandemic crisis. Now, this may be culturally attendant to this physician in his country, or it may be something that you feel. But I have a question. Do you feel that healthcare providers have a duty to provide care during a pandemic, to have a duty and an obligation? Do you believe that is true? And if it is true, then reciprocity must then also be true. If you are expected, if we expect that you have a moral obligation to us to work in harm's way, then we must reciprocate as the government, as institutions, and as individuals. So when we enter the hospital, for example, we should wear a mask in deference to you. Iris, I think you raised a hand, but I don't quite know what to do with that. If you could chat, it would be easier for me. I am still learning this platform and don't know about hand raising quite yet. So reciprocity is we owe you if you owe us, for sure. And then privacy, and we'll talk about privacy later. And privacy is not so much that HIPAA related information will escape. That could happen. Privacy is more nuanced. Think about it this way. You post, or someone you know post on Facebook that you have COVID. Everybody that you know that you've seen in the last 5 days then knows that you have COVID, and they may in fact also have COVID. They may then post. So let's just say that things go really awry, and someday there is some sort of penalty for having COVID or for not having a vaccination, and you have just willingly, made yourself a part of that list of people to be discriminated against. So privacy is not just a matter of the trading of data and records between institutions. Privacy is the privacy that you should afford oneself using social media. Oh, Iris, thank you for letting me know it's an accident. I don't feel as bad now that I can't help you with hand raising. So those are the 7 ethical principles. Let's now address procedural values. So procedural values and ethical principles, 2 different things. Ethical principles are the guideline by which you make the decision, the parameter and the construct within which you make the decision. The procedural value is how you arrive there. And so what I love this little article that I found, which is the 5 procedural values that are necessary during ethics. And these are reasonable. I'm sorry to use that word because I'm using it again right now, but number 1 is reasonableness. Decisions made should be based on the best available evidence and proportionate to the threat, made by credible people having expertise and experience in the field, and should have a reasonable chance of being successful. This is reasonableness. And this should be number 1. This really should be perhaps the guideline or the guidepost of your personal ethic, or my personal ethic, let's say, is the reasonableness of holding that position. Openness is another procedural value that we want to employ when we are faced with an ethical dilemma. So we want to be reasonable. Is the decision we're making reasonable? Will it work? And then we will be open. So we'll be open to other ideas, other solutions, and we want to be open so that should things not be optimal, we want for there to be a transparency so we can see where we went wrong and how to correct. And we have to communicate throughout. That's what transparency is communication. Inclusiveness should include all relevant stakeholders. And again, I'll go back to we're not including all relevant stakeholders in discussions of COVID-19 and vaccinations if we are only talking with healthcare companies, because there are quite a number of people who aren't represented in that block. Responsiveness. This has proven to be true, I'm pleased to say, during our pandemic response. As I just said, nursing homes, assisted livings have changed their response to COVID lockdowns. And this is because they've been making decisions along this trajectory of this pandemic, have seen where things were done properly and where things should have been done differently, and are making those changes. And then accountability. This is on all of us. We have to be accountable to the decisions that we make when facing these ethical dilemmas, whether it is getting vaccinated or wearing a mask or whatever it may be. We have to be accountable, and we have to hold those above us accountable, which means things like holding accountable social media websites. We'll talk about that in a minute. So we're going to roll on out of the numbers game here with this slide. But I just kept finding all these wonderful lists, and I wanted to share them with you. This is the same pastor, priest, Catholic priest, who wrote the other 5 basic ethical dilemmas. And so he said, now this article is written later in the pandemic, so he's changed his thought a little bit. And he's now saying, hey, the pandemic makes its own rules, therefore the ethics change. But what has changed for all of us is we all faced, many of us for the first time, really, scarcity. Now, about 4 billion people live with scarcity. People across town in the city of Birmingham live in a food desert. That's scarcity. You know, so scarcity became not this remote, you know, someone in another continent, in another world, if you will, and it's not just someone even in another part of the city whose lives don't interact with ours. No, it's more than that. It's we all faced it. So the rich and the poor, the black and the white, you know, the healthy and the unhealthy all face scarcity. And that's what changed us as a culture and the people during the pandemic. And it also meant that our ethics had to change with us. And so the focus of medical ethics shifted. So the rule became save as many lives as you can. And again, the way to do that is to save healthcare workers first. What that meant, though, is that we have a carnage in our healthcare system among the many healthcare workers who have made these daily decisions around ethical dilemmas of who will survive best. Will it be the 25-year-old with no comorbidities, or will it be the 65-year-old waiting on a kidney transplant? I mean, I think you know the answer, but do you want to make that decision? And if you did, God bless you, and I really have deep empathy for you. That's powerful stuff. So when we shifted the medical ethic, we said save as many lives as we can. And so again, we had to ration healthcare, scarcity. We had to ration healthcare. Who's going to survive? And we had to save those who do the saving. That's you and your colleagues. And in order to save others, you have to be in place. This is what we tell, you know, our caregivers of dementia clients is, if we don't save you, we can't save him, you know. And it all comes back to the choices we made in the past and in the present. We'll talk about those in just a second. But we made some bad choices. I think we all know that now, in how we prepared, not for COVID-19, but for a pandemic of any sort. We did not prepare. And so we're now going to address 3 current ethical dilemmas. I love this graphic I found. I Googled a superhero clinical person, and I got this, and I love it. I think it may be my screensaver from now on. But I'm sorry, that was an aside that was of little value to you. So first, before we get into these 3 questions, you know, we've talked about the 5 basic ethical concerns during a pandemic. We've talked about the 7 ethical sort of principles that we need to follow. We've talked about, you know, the 5 decision-making models that have changed during healthcare. And now we want to give you just a little perspective on maybe the decision-making models that have been employed during COVID as would apply to risk and how risk is assessed and viewed. So we're gonna look at that, and I think it would be interesting for you And I bring it up before we talk about these ethical questions, because I think you may see yourself in one of these. And one is not necessarily better than the other, although we will posit that one was better, would have been a better response during the pandemic than the response that we had. And so when assessing risk, there are four sort of basic categories that the folks who do this use. It's called the risk standard. And what the article that I found, which I found fascinating, this person who was a risk adjuster, I guess, said that the decision makers, if they were following a risk standard, and that's a big if, right? That they were even viewing this as a threat. And it's plausible they weren't, if you remember that time. But if they were even using a risk standard, they were probably following prudent vigilance, or the gambler's principle, which I would be my vote, when they should have been following precautionary principle or the prevention principle. And so prudent vigilance in terms of risk strategy or standard, it says that it's permissible to take risk, but you continually analyze the situation, you reevaluate, you correct, and you're sort of fluid in your decision making. And this is, again, where we sort of have ended up during COVID and the pandemic, is in this sort of prudent reassess, reform, take feedback, reevaluate, reassess, reform. And that is because what that viewpoint, according to the author, says is that our pandemic response was to have something prepared, but not a lot, because unless there was a real threat, unless a threat was on its way. And so that was sort of this sort of laissez-faire position that we took in the United States and in our institutions, including healthcare. And then I think maybe those in the administration at that time sort of probably used the gambler's principle, which is don't bet more than you can afford to lose. Or in other words, bet what you can afford or what you think you can afford to lose. And the problem with what you think you can afford to lose is that is a subjective argument, and it's subjective to the person making the decision. In our case, it was the government. But, so their opinion was subjective to what they sought and needed. Does that make sense? And not necessarily maybe what data suggested, or what the trajectory was showing, or what the analysis was coming up with. This was not where people analyze. This was more where people are fluid and just change, and only do as much as you might need to do, but definitely hedge your bet against the biomedical weapon. Do nothing for the flu. And at that time, as y'all know, many people were equating COVID-19 with the flu. We now know it's not the flu. What the author suggested, and I like, is that we really might have been better served if we had used, in terms of risk standard, the precautionary principle, which is when facing an unknown, take the most cautious route. And the cautious route, or the most cautious route, is the one that's going to prevent what would be the absolute worst outcome. So the most cautious route is going to look for the worst outcome and avoid that. And so that approach, if that were the approach that our institutions took, would have been one that would have been, very many responses ready. There would have been many precautionary roads gone down, and every possible, scenario planned out and evaluated and readied for. And so that's the precautionary principle, and it differs slightly from the risk standard of the prevention principle, which is that when the threat is acknowledged and understood, it should be addressed exactly as it is. This goes back to our notions of proportionality of the response. And so in the prevention principle, it really sort of goes back to what we've talked about in other ethics courses since I've been doing this since February, and in other topics, which is be mindful of the present, accept what is, and address that as it is and only as it is. And that seems to be the guidepost for living life. And in this case, maybe having better responded or having a better future response to this pandemic and others. Now, what's happened with us? Perhaps we took the gambler's principle in 2020, but what we've now done, we haven't shifted forward. We've shifted sort of sideways and possibly backwards. We've gone down the road, the risk standard, the pro-actionary, which encourages risk taking in order to get out of unacceptably risky situations. So what does this mean? Well, it means all of the COVID relief packages, right? These are highly risky for the economy, for the ongoing economy. And I'm not political at all. I have no political horse or stripe. But now we have $1 trillion, I think, bill for the pandemic. And we don't know what that's going to bring. And so what we now have what might have been a simple ripple in a pond is now a wave, and we're on that wave, and we're not sure where it's going. And those are the risk standards that you might apply as we talk about the next few issues that I think may be interesting for you. Well, let's go. Okay. So what we've seen during the pandemic, and we saw this certainly in 2020, but it's held, it's a habit I think we have now, that at the one hand, we're less connected than ever with folks. And on the other hand, we're more connected because the vast majority of us retreated to our tablets and laptops and phones and devices during the initial lockdown. And we learned, again, we had to. That's how we got services, Amazon and food delivery and other things. It's also how we found respite from our wife or husband or children or parents, or just general chaos or utter boredom in our homes. And the thing about the internet that it's sort of true is that people have an innate need for knowledge and information, and the internet has become and is the go-to for the gathering of knowledge. And so if you look at potentially bad actors during a pandemic as relates to one of our greater pastimes in which we are more at risk, what did we see happen in 2020? We saw a lot of apps that were developed that were supposed to track, the progress of COVID, either hospitalizations or deaths or trends. And a lot of, they're just an app on a phone. You don't know from where they come. Well, many of them, it was learned later, were establishing surveillance on the phone or device onto which the app was installed. Well, you've breached your identity and your financial records at that point. And so they used our thirst for knowledge and our fear that drove us to the internet against us to steal our identities. And so we have to then now, with greater fervor, police the internet and the social apps and media sites that we use. So how do we do that? There was the World Health Organization had wanted to partner with WhatsApp in order to get, truth out, or their word out on the pandemic and the pandemic response. And WhatsApp agreed, and they said they would assist in that case. But one of the things they realized was necessary was to discredit misinformation, which could be potentially dangerous for other folks. And so what they found, what the app found, what WhatsApp found, was they couldn't police the misinformation. They weren't prepared for it. They weren't prepared for the spread of it, for the rapidity of it, for the just the sheer number and volume. They weren't prepared. And so what that is, it tells us that that's, if it's true for all of these apps and applications and programs and sites and whatever, verbiage you use for them. So I found a really great article, and I want to share it with you. And it's the simplest way to spot coronavirus misinformation on social media. The author is Will, I can't say his last name, I believe it's Aremus, and it's on 10medium.com. But he offers some really great tips for, when you encounter information online, and not just about COVID, but really anything. He has a process that he outlines in this article, and it's a fourfold process. And the first step is when you encounter information on the internet, in whatever form, fashion, on whatever vehicle, an app, a website, what have you. When you encounter that information, and it's, for whatever reason, piques your interest, he says, stop. Don't read the article. Don't try and either, justify what's in the article or discount what's in the article. In fact, don't, other than just the general gist of the article, don't peruse it. And then he says that you need to look for other sources of information on that same topic. And what you may use to, in his case, you may take that title and just Google it and see other articles that either support that, name that, or refute that. The next thing he says is that you find better sites. So you may see a headline that piques your interest. You see this all the time on, on a homepage for like MSN or something. And there's this, so-and-so ad type thing, and you click through and click through and click through to see, what a child actor in the 70s looks like now. And so you go through that, and all of this, those type things, you see all sorts of stuff that may or may not be true. Instead of believing it and acting upon it, certainly if it's something of import, like COVID, not like child actors. But if it's important, find other credible evidence to support that or to refute it, and take that evidence and substitute it for the original article if it is more credible and from a better, source. And then you try and find other avenues of getting that information out. But then and so by that point, you haven't gone down the rabbit hole of an article that may be inflammatory. Instead, you've looked at articles that may either support that or refute it. You've found other credible evidence, and now you are prepared to make the decision: do I believe this thing or do I not? He also has a different website called Sifting Through the Pandemic, or a different blog, and they're both great articles. If you you'll see this presentation, I'll send it out. So the thing about the internet, and I'm running out of time, so let me speed up. Here's the thing that can be harmful. I know you think, well, what could be really harmful in the internet? It's this: This was a tweet that went out in 2020. Says hand sanitizer is antibacterial. The coronavirus is a virus. A bacteria and a virus is not the same. Wash your hands. Sanitizer will do nothing for the coronavirus. Sincerely, a scientist. So this person self-identifies as a scientist. People say, oh, that's plausible. She's a scientist. I must have to agree with her. And she says that hand sanitizer doesn't work. But at the same time, the World Health Organization said that 60% alcohol-based hand sanitizer did, in fact, kill the coronavirus and was, in fact, a plausible, preventative act. The problem is that in a matter of hours, this was retweeted 81,000 times. And it was like 241,000 times. And by the end of the day, not only was it on Twitter, it had made it over to Instagram and into Facebook, where it was shared and reposted and liked and promoted again. And so this little almost innocuous piece of information could actually have a bad effect on people who, for whatever reason, lack sanitary conditions, but have hand sanitizer, but believe it doesn't work because of some tweet, when in fact it does. And then they get sick and they die. And that's why this matters. And I don't mean to be flip about that. Here's the CEU code word. I'm sorry, I'm 5 minutes late giving it. It's prevention. And y'all, it's a capital P, everything else is lowercase. Prevention is the password code word today. So here's contact tracing and oh, I'm sorry, let me get back to, here's a question I want you to ask or answer. How do we preserve the right to access to information with the need to police misinformation? You can either, if you feel confident answering that in this, do. The web address will be given again, Sarah, at the end, and I'll get there shortly. I'll hurry up. So anyway, this is the question that will be on the evaluation. I'll speed through this because we're running out of time. Basically, there are 4 groups of privacy advocates who lobby for different measures of privacy, from those who say that now is the best time to do things like contact tracing or other things because of the pandemic, and we can justify it because there's a public good or a public need. And then there are those who say, well, we don't even know that things like vaccines work. And so, or that contact tracing works. And so why would we then create laws and police something that we don't even know works? Thank you, Ashley, for answering Sarah. So that's the basic of that. So really the debate around contact tracing. And I remember, this means I've got COVID, I have to let somebody know, and then somebody lets somebody else know. And then there's some big database out there with me in it, with my scarlet letter. And so it does very much step on or implicate human rights, individual rights, and fairness. And it juxtaposes those with the common good. Now, we've said all along the common good outweighs the individual right. Do you believe that? Is contact tracing necessary? Does it outweigh what the government or other actors may do with that information? That's our second question for our evaluation. And then lastly, we want to talk about the World Health Organization. And I just want to say here that, I said early that we listen to what they say in America at the CDC and elsewhere. And they have a white paper so that they have a white paper about should we vaccinate or should we not? And in the end, they come down on the side of we should not vaccinate. So I say that to say this, and they say it for the same reason, the data is not there. But I ask you, because what we saw with mandatory vaccination was the people could not be penalized, so you couldn't be jailed or have any sort of penalty, a financial penalty to pay, at least not one that was a direct relationship. Now, the financial penalties that you lose your job if you don't, or you lose your ability to go to class in college or at high school, or you lose your right to go to the office if you work in an office. And so, is mandatory vaccination necessary and is it proportionate? And so actually, let me right here, I'm going to type in the link to SurveyMonkey. There you go, everybody. And I believe we're at the last slide. We sure are. SurveyMonkey.com, / r / all uppercase, B as in boy, the number 9, K, the number 8, S as in Sam, W, K, code word, which is also the password. The evaluation is password protected. You'll need the password. It's prevention. It's capital P, REVENTION. If you can get those done by 6 today, I'll try and get all the certificates out this evening. Again, I'll be posting the ABN as soon as I get I guess it's called a tricorder back from them, which we will, is the mechanism by which I need to do that. And then social workers and all of you will receive certificates by day's end. We do appreciate what you do for us, what you do for others. And I do want to say again that I appreciate the sacrifice that each of you have made the last 2 years. No matter what setting you are doing patient care in, you've had it not only take a toll on you personally, as I have, as we all have, but you've had a work product and environment which was unlike anything you probably ever expected. And you survived, and I salute you and I thank you. And I hope that the things that we do for you, like these certificates and CEUs, have value and give back, which is what we'd like to do. And if they do, if you would, let other people know about them and share with them. And we'd love to have a much bigger audience so that we knew that we were doing, good work. But anyway, I thank y'all for all that you do. I don't see any questions really necessarily. So I'm going to let y'all go today a little early. So go get a drink of water. And again, I hope if it's not shining literally on you, I hope the sun is shining on you today in a figurative sense. Y'all have a great rest of your day, and we'll see you Tuesday. We have Mr. Ayers. I believe his last name is Ayers. I should know this. He's a graduate of the Alabama Institute for the Deaf and Blind. One of our listeners prior had asked about topics relating to the sight impaired, and I felt that how we deal with the sight impaired during COVID and in healthcare was a wonderful ethics idea. The password Sarah had, is prevention, and that's a capital P. All the other letters are lowercase. So we'll have next week on Tuesday, we'll have the sight impaired ethics. And then on Thursday, we will continue our series. And then in the 28th, any of you who are social workers, you're going to need this. We're going to have self-care for the social workers. So y'all pass that word around. Again, the password, everyone, is prevention. Uppercase P, all other letters lowercase, prevention. Thank you again. And I hope you all have a wonderful, as I said, rest of the day and weekend. And I look forward, hopefully, to seeing you all on Tuesday. Come on. Now I can't get the tab to pull up, y'all. I apologize.